Welcome, Professor Rich RN here. I am an assistant professor in a school of nursing, and I'm also an NCLEX coach. My goal for you today is to walk you through some of the case studies that you might encounter on the NGN, which we all know is beginning in April 2023. That we're going to cover is a case study, and we're going to cover the case study Select All That Apply. So here you can see we have nurse's notes. We have a client that was brought into the ED by her daughter due to increased shortness of breath in the morning. The daughter reports that the client has been running a fever for the past few days and has started to cough up greenish colored mucus and reports soreness throughout her body. The client was recently hospitalized for issues with atrial fibrillation 6 days ago. The client has a history of hypertension, gives us some vital signs there. We have a blood pressure, pulse oximeter 94% at 2 liters via nasal cannula. Upon assessment, the client's breathing pattern appears slightly labored and coarse crackles are noted bilaterally in the lung basis. The skin is cool to touch, pale in tone, pulses are 3+ and irregular. Capillary refill is 3 seconds, and client is learn-oriented to person, place, and time. The client's daughter states, "Something seems like my mother is confused." So here in the case study Select All That Apply options, we have the case study, and we have to pick out what are those important things based upon that story. So if we go back to our options, we have vital signs, lung sounds, cap refill, client orientation, radial pulse characteristics, and characteristics of a cough. Okay, so 4 things we'd want to pick from. Immediately, we probably would say fever, so vital signs, lung sounds, client orientation, and then we can continue to evaluate that. But this is just an example question for that one.